Well, I'm sure once we get through the pandemic, we'll be able to look back and say, which countries got testing going very quickly, which countries did contact tracing, the various measures like wearing masks, the leadership in terms of getting people to adopt that varied a lot from country to country. And of course, you had a different number of people coming into a country with the infection. Countries that had a lot of international travel got hit first, and then there was some delay getting into other countries. We believe it's fairly seasonal disease. So unfortunately, in the Northern Hemisphere this fall, the force of the infection may go up quite a bit. But there, as you say, there's a range of results where some countries, particularly those that had had to deal with MERS or SARS before, they got the testing in place, quarantine in place very quickly. And because this is exponential, if you can stop something at a low level, then it never gets to those big numbers. Unfortunately, in the United States, we didn't check the travelers coming back from China. The travel policies had no benefit because the 40,000 weren't tested and weren't quarantined. And so, the U.S. Has had a much worse epidemic than I would have expected. Yeah, the key to the report, which unfortunately this year has to be a bit of a negative message, is to make it clear to people that it's not just the direct impacts of COVID, where the deaths are horrific and the sickness and everything, but these indirect effects, including because the health systems are very fragile, particularly, the less wealth a country has, the less extra capacity there is in that health system. And so things like routine immunization, or in Africa, malaria bed nets, HIV medicines, we've had disruptions to all of those things. And in some of these countries, those secondary effects will actually cost more deaths. The economic effects that you mentioned are even more difficult to come back to. If we do a brilliant job, we end the pandemic in 2022. If we're lucky to have a lot of good vaccines that are made in volume, I'm sure we'll talk about that. The health systems should be able to get back fairly quickly. We'll have to do catch-up vaccination. But the economic damage, particularly in countries that couldn't borrow huge additional sums like some of the rich countries, you'll have big setbacks. You'll have the educational deficits, which are even harder to measure. What does that mean in terms of the life of those people, or even the economic effects of those things? So, some of the extreme poverty type things could take us 5 to 10 years to get back to where we were at the start of 2020. So our foundation is usually telling the positive story of gradual progress all over the world, including, in India, that the health statistics have gotten better and better. But this year, we're a bit of a negative warning that restoring these things needs a real focus, and the vaccine cooperation needs a real focus. Well, I'm not an expert on the Indian epidemic. India's got high density cities, and yet, people don't have, big houses, and, a lot of the work is not the kind of office work that's easily done over an internet connection. And so the very difficult trade-offs of what you do in terms of economic activity versus trying to stop the disease spread, I don't envy the Indian leaders the tough decisions. And, each community probably will have to tune this, because if you look throughout India, the force of infection is quite different in different locations. Sadly, it's the slums appear to be where you have the most transmission. I did speak to the Prime Minister early on. We talked about how our foundation, working with partners like Tata Trust, wanted to help out. We've done some of these COVID facilities. But yeah, India, particularly if the fall is as tough as many of the models are predicting, you have tough challenges. There's very few obvious things. Wearing masks is one of those few things where the cost and the inconvenience is low enough that having the leaders really model that and get the word out, and even a little bit of pushing people on that in a tasteful way, that will be quite valuable. Well, this has got to be a global effort. You need many countries to have the scientists working together, many countries for the trials for these vaccines. And for the first time, we're going to have a vaccine that's created by one company that, in fact, will be manufactured by other companies as well. And of course, India has a huge role to play in that because the highest volume vaccine manufacturers in the world, who've done a fantastic job and partnered with us on many of these life-saving vaccines, including Serum, BioE, Bharat, they have capacity. And so we've been in lots of conversations with the companies with the vaccines that look like they'll be low cost and very scalable, including AstraZeneca, Novavax, Sanofi, and Johnson & Johnson. All of those, we think we need a way, if they succeed in their phase 3, which is still underway, we want to be able to ramp up that manufacturing capacity. And so we've done a number of deals. We'll do more. I do think of all these vaccines, by early next year, of the leading, say, 6 vaccines, probably 3 of them will work. Now, we'll have to study how well they work in terms of blocking transmission or avoiding sickness, but I would expect some of them will work very well. Because of the need to get them out, we'll want to go to full volume manufacture on many of these constructs. I think most of the world will want a vaccine that's been reviewed by a top-notch regulator, which generally, US FDA or Europe or UK. So ideally, they would be involved. So if we can get these Western vaccines through partnerships, particularly with India, into high volume, if we can get the money to procure them for even the poorest countries, I think the Western vaccines will be used overwhelmingly. If there were delays, then and there wasn't enough money to donate them, then countries might face a challenge of, okay, should they use an unproven, Russian vaccine, or what should they do? Our foundation, is looking at all the Chinese vaccines. Some of them may work well, but the Chinese regulator isn't, even though we've invested in helping that regulator get better, they're not yet at a level where most countries would immediately say, okay, just because they like it, we're going to tell our citizens to go take this. So it's pretty complicated, but cooperation, generosity, the whole world's got to end this thing because no country on its own really can keep this disease out. Well, certainly the governments failed to prepare. They didn't do, sort of war game type things. They didn't know the testing should come in. And usually the world benefits from the U.S. depth of expertise. The U.S. CDC is very strong. U.S. health research is very well funded. This one did catch us by surprise. The warnings that I and others made were not heeded. Very little was done, although CEPI was created, which India was a partner in this CEPI. But we will do a lot to make sure that when the next one comes, we are far more ready with testing, with drugs, and having vaccine platforms that can move very, very quickly. And, as yet, the U.S. has not stepped forward on the aid money for this vaccine, but I'm still hopeful that'll happen. Well, primary health care in India has been improving over the decades. It still has a ways to go, but new vaccines have been introduced. Childhood survival has improved quite a bit in India. For example, in measles, new actions were taken that have started to bring those numbers down quite a bit. So we have to get back to where we were at the start of the year and then get back on that curve of increasing. Obviously, our foundation and others have advocated for even more resources for this primary health care part of the system, and over time we hope that's possible. Of course, the competing budget priorities are going to be very difficult, as people craft this overall recovery plan. But catch-up vaccinations will be very important. And, I think, at the state and district level, being honest about, okay, what did we miss during this epidemic? It'll be important to use data systems to really spot, because it varies a lot. Even within a state like UP or Bihar, there are places where vaccinations have continued, places where the supplies or workers, where it was shut down. Well, a lot of what's happened in this pandemic has accelerated the digital revolution that was going to take place anyway. More of shopping was going to be online, more of education was going to be online, more of medicine was going to be online, more of government, not getting rid of the paperwork and having the pure digital approach. That was going to happen, but this has accelerated that. To give one example where India's certainly one of the leaders, India was able to use its digital financial capability, where Aadhaar and the overall NCPI payment system works very well. It was able to use that to get money out, particularly to women, sometimes through the self-help groups, very rapidly. So other countries look at that with envy, because their physical distribution, their ability to really identify and stop the money from being diverted as it is distributed is not as strong. And so digital payment systems, there's a lot of countries that the foundation and India together are talking to about, okay, let's help you implement this type of system. And telemedicine has worked better than many people expected. For older students, the online works well. As you get to the younger students, we really do need to get them back into the classroom. Well, fortunately, the interest rate costs are fairly low for most governments, and so a lot of what we're seeing is that they're going to borrow money and replace some of the incomes of the people who aren't able to go in and do work, or where the demand's not there. For example, tourism is completely decimated, and it'll take another year probably before that will get back in place. So these are very difficult trade-offs, and we're still debating. Was what Sweden did, a mistake versus what some other countries did. The people who caught it early, we all envy them. The U.S. should have been one of those countries, but Australia, South Korea, even China itself at this point has very, very few cases. Well, sadly, the pandemic is tougher on the people who were behind before the pandemic. If you're an office worker like I am, if you have a nice sized house with a great internet connection, the pandemic has not been a disaster, for me. I'm actually surprised how the foundation's work has continued. When we said that day in March, okay, we're not coming into the office, I thought, oh my goodness, the work will really, really slow down. And in fact, in most ways, it hasn't. We can't do drug trials out in the real world, but our office work has gone surprisingly well. And our foundation, which is about infectious diseases, and partners with groups like Department of Biotechnology, Principal Science Advisor. India cares about infectious diseases, so we've always had deep partnerships there. In most of the rich world, infectious diseases are sort of a thing of the past. So people are kind of surprised when they say, hey, who understands vaccines? Who understands high volume, low cost vaccines? Well, that's, the Gates Foundation and some companies in India. And so our work is more mainstream for the rich countries today than it's ever been, because, malaria, they don't care about that, or pneumonia, diarrhea, those things are not big killers in the rich countries. So we've been working very intensely in crafting these partnerships because we don't want to use price and wealth to determine who gets the vaccine. We need to use, more human, all lives have equal value type views, which is really actually the credo of our foundation. The quality of education in India before the pandemic was not ideal. And so the opportunity to say, okay, there's places in India where kids get very, very good education. But overall, the system could become a limit on India's economic growth. And so, when the Prime Minister asked us to get involved in some of this teacher training stuff, working with other partners, I was glad to see that as a priority. Most of our work is health, but we do a little bit partnering on some of these education things. Teacher training can be done in an online fashion. Some of the things that Nananeel Connie is working on in terms of taking the digital revolution the same way he did help with the finance piece, now applying that to education, there's some very promising things there. Now, those won't happen overnight, and they mostly work for older students, if you're like 12, 13, 14, and as you said, you have to have an internet connection and a device. And, even in the United States, we do not have universal connectivity, and so we're working on that. But in our case, it's kind of filling in the last 20%. In the case of India, it's sort of filling in more like 50%. And partnerships with, private companies, may make sense, or making sure that if somebody's using the internet connection just for education, that's priced very, very inexpensively. Some of the education work can be done on a small screen, but a lot of it works better as you get that larger screen interface. And of course, the bandwidth for, say, a video lecture, has to be pretty good. So, time is on India's side. Groups like Geo are building out infrastructure, and that piece will get there. But getting the teachers and the training and the content, that could be a limiting factor. Well, I wouldn't have predicted that there'd be all these crazy conspiracy theories and, a lot of anti-vaccine sentiment. even in the U.S., we see things denying that people are dying, acting as though that somehow was politically motivated and not the truth. And so somehow in these digital social media things, we need to get the truth to travel as fast or faster as the interesting lie. And yet right now, because many of those are couched in kind of a, hey, this other group is spreading the infection, they're bad people, which sometimes humans fall prey to that us versus them type thinking. Some of those malign messages spread way faster than the truth, which is no, there's no group that's trying to spread this disease. We're all in this together. We need to cooperate. Some of those rumors have even focused on me, saying that, okay, because I work on vaccines or I warned about this epidemic, somehow I'm behind it, or, I'm trying to do something evil. And in a way, I can sit and laugh because it's so much the opposite of truth. But it's kind of a serious thing if people think about vaccines in this negative way. And they're not, they think, okay, this mask stuff is not a super important thing. So I think we are going to have to step back and say, what goes on where these quack remedies get promoted and people believe that? How do we have the trusted leaders get their voice to be stronger than the crazy stuff? The social media companies are trying, but we haven't found a good enough solution because the crazy thinking is getting out too much.